Thank you. Thank you very much for a kind introduction about me. Today, I would like to talk about gastrointestinal cyclodextrin chemistry for the human healthcare. We have long pursued gastrointestinal cyclodextrin chemistry for more than 20 years. And we discovered actually cyclodextrin is a remarkable substance to reduce the risk of the life-related disease such as obesity and diabetes and atherosclerosis and also cancer. But our discovery, unfortunately, has not yet been known to the medical professionals such as medical doctor and also the pharmacist. So on this occasion, I prepared my talk not only for the participants here, but also for the medical professionals such as medical doctors. So by asking the professional video cameraman to record it, and I want to use this video now. So first of all, I have to tell you that actually my research, there is a restriction. The restriction to use cyclodextrin in nutrition field. As you know, in the pharmaceutical field, of course, dosage administration can be specified. That means not only natural cyclodextrin, chemically modified cyclodextrin derivative can be used. On the other hand, in the nutrition field, you can eat as much as possible. That means dosage administration cannot be specified. For safety reasons, only natural cyclodextrin can be used, and only in the gastrointestinal tract. This is restriction. First, I have to tell you. Then, our findings consist of the four. The first one is bioavailability enhancement, improving solubility in small intestine by the gamma cyclodextrin. And second one is also the bioavailability enhancement, but not only solubility improvement, but also the stability in the stomach in gamma cyclodextrin. And third one is absorption inhibition, but carbohydrate and lipid by the alpha cyclodextrin in small intestine. And last one is in large intestine, improvement of the intestinal environment by the alpha cyclodextrin. And here I selected 3 of the life-related disease can be resolved nutritionally by the cyclodextrin. First one, I selected diabetes. Here, risk of diabetes onset associated with statin. I want to talk first. Most of all people are going to the health checkup once a year, I suppose. Then, as a result of the health checkup, if you find LDL cholesterol level is more than 140 milligrams per deciliter, usually you are asked from the medical doctor to take medicine, statin. And of course, statin has an efficacy. Cholesterol biosynthesis is inhibited. That's why reducing risk of atherosclerosis. But recently it was found that there is a side effect. That is, adiponectin secretion is decreased, then increasing risk of diabetes onset. It was found with a cohort study with 68,620 Japanese dyslipidemia. Without using statin, if you take the high potency statin like atorvastatin, pitavastatin, rosuvastatin, then your risk becomes 2 times or 3 times higher to be a diabetes. And the mechanism for the diabetes onset, usually for a long period, only 2 factors believed, genetic factor and also the environment factor induced obesity by the high-fat diet. Only 2, but now we have to know the statin medication. 3 factors giving the decreasing secretion of the adiponectin, decreasing MPK, and the PPA alpha. So in your body, triglyceride level is rising, then insulin resistance is increasing. This is the risk of diabetes onset. Not only increase of the risk of the diabetes, obesity, atherosclerosis, but also cancer risk also rising. So what is a statin? Everyone knows. This is the inhibitor of the hydroxymethylglutyl coenzyme A reductase. And because inhibiting this enzyme, mevalonic acid is not produced. So in the synthetic route, cholesterol is available, and the cholesterol biosynthesis is inhibited. But in the same route, coenzyme Q10 is also synthesized. And the coenzyme Q10 biosynthesis is also inhibited. That means that's why adiponectin secretion is decreased. This was a risk of the obesity, diabetes, and cancer. So in case if you take the statin, please take the coenzyme Q10 as a supplement. And you can see by the statin medication, it is reported to decrease the blood coenzyme Q10 level. The pravastatin, simvastatin, and atorvastatin, the coenzyme Q10 reduction rate is the 25 to the 54%. So the coenzyme Q10 is produced in your body, but the production decreased from the 20s. And by the age of the 80s, production dropped to less than the 40% compared to the age 20. Then can you imagine these elderly, can you imagine how much it will decrease by taking statin? Actually, coenzyme Q10 production and the number of the human cells are related, positive correlation. The coenzyme Q10 is the coenzyme for the ATP production to keep the number of the human cells. So when the number of the cell drop below the 23 trillion, human reach the end of life known. So this is really deadline. So Keio University reported that blood adiponectin level at super elderly over 100 years old twice higher than the Japanese average. Huge difference here. Statin medication for the elderly over 80 leads to the decrease of the coenzyme Q10 level and decreased adiponectin level and increasing apoptosis of the human cell. In other words, the statin can be said to be the aging accelerator. So the 1/3 of now Japanese population is elderly, including me. 1/3 of the elderly, this is not me, but elderly are statin users. That means more than 10 million people have a risk of the diabetes onset by the statin here. So the statin user should take the coenzyme Q10 together, but the coenzyme Q10 has a problem, fat-soluble substance with extremely low bioavailability. Here we found cyclodextrin could solve this issue perfectly. So first one is bioavailability enhancement, improving solubility in the small intestine by gamma cyclodextrin. 20 years ago, we found the bioavailability enhancement of the coenzyme Q10 bioavailability by the gamma cyclodextrin compensation. So those days already coenzyme Q10 is a pharmaceutical ingredient. So the pharmaceutical company developed already a drug formulation using oil emulsifier. So without using oil emulsifier, actually bioavailability is enhanced in case of the drug formulation. But compared to the drug formulation, gamma cyclodextrin complex is much higher. So those days, 20 years ago, we did not know why. Because here, coenzyme Q10 gamma cyclodextrin complex is not water soluble, but highly dispersible. So under the situation why coenzyme Q10 is the bioavailability could be enhanced, we did not know. Around more than 10 years it required to find the mechanism. Today I cannot show you in detail about that, but I want to use a video to explain briefly. The coenzyme Q10 gamma cyclodextrin complex is not water soluble, so not soluble in the intestine. That's why amylase cannot attack to decompose gamma cyclodextrin. But in the small intestine, bile acid is available, and the bile acid fit well with the gamma cyclodextrin. So the coenzyme Q10 is going out, but via molecular missile, coenzyme Q10 absorbed well. Then obtained bile acid gamma cyclodextrin complex is water soluble. That's why the amylase can attack to decompose the gamma cyclodextrin into the glucose. This was the mechanism we found. So in bile, there are three key ingredients. So there are lectin, cholesterol, and bile acid. Everyone knows here they are in the cyclodextrin conference. Cholesterol is fit well with the beta cyclodextrin. Here we found bile acid fit well with the gamma cyclodextrin. On this occasion, chemistry means their compatibility. So the good chemistry, gamma cyclodextrin and bile acid has. That's why bioavailability could be enhanced. So the next one is bioavailability enhancement, improving solubility in stomach by the gamma cyclodextrin. We selected alpha lipoic acid because it is a key substance to glucose metabolism in mitochondria. It is used as an anti-diabetic drug. Therefore, synergistic anti-diabetic effect of the RR and coenzyme Q10 expected. So then we evaluated the RR, but RR is unstable. That's why, because of that, bioavailability is not so high. That's why we try to stabilize with cyclodextrin, and we found also gamma cyclodextrin is useful to stabilize. Some stability and solubility in acidic condition both perfectly stabilized by the gamma cyclodextrin compensation, and also solubility. The other gamma cyclodextrin complex is higher, significantly higher than non-complex. You can see that. So here stability and solubility both improved by the gamma cyclodextrin compensation. We expect, of course, bioavailability enhancement here. And at the Kobe University, we did a human study, and we see actually AUC after administration of the complex and non-complex, then 2.5 times higher than the non-complex we found. Here, that's why we suggest for the 10 million elderly statin users, please to compensate the risk of the diabetes caused by statin medication. I would like to ask the medical doctor to recommend to take the coenzyme Q10 and RR, both gamma cyclodextrin complex. We reported improvement adiponectin secretion by the coenzyme Q10 gamma cyclodextrin complex reported in year 2010, and also the RR reported in 2013. So not only coenzyme Q10 and RR, their bioavailability enhancing technology can be used for not only both, but tocotrienol, curcumin, geosgenin, and many others we see. So next one is I selected atherosclerosis as a risk. The actually real risk factor to cause atherosclerosis is not LDL cholesterol, but the small dense LDL cholesterol. I want to explain. There are more than 95% of the medical doctors still believe LDL cholesterol is a risk factor, but it's not true. First, I have to explain what is small dense LDL cholesterol. As a carrier of the fat, we know the four categories. One is the chylomicron, and second one VLDL. Both are carrier of the triglyceride, and the LDL and the HDL is a carrier of the cholesterol. So then we have to divide the LDL cholesterol into two groups: large dense LDL cholesterol and small dense LDL cholesterol. And the particle size of the small dense LDL cholesterol should be less than the 25.5 nanometer. The reason that already many scientific reports is available to show the real risk factor is the small dense LDL cholesterol. Only one I want to choose. I choose and I want to explain. This is a analytical data for the 10,000 healthy people and coronary heart disease patients. You see the LDL cholesterol level. Healthy people and the patient does not have any difference. And in case of large dense LDL cholesterol, you can see that there are no significant difference, but the healthy people has a little bit higher. The problem is the small dense LDL cholesterol. You can see that compared to the healthy people, patient has much higher. So this means small dense LDL cholesterol is really a real factor for the disease. So the measurement of the small dense LDL cholesterol is essentially required. If your LDL cholesterol level is the range of the 130 milligram per deciliter, in many cases you believe I'm okay, but it's not true. Depending upon small dense LDL cholesterol level, there are two types of people develop their coronary disease or who do not. The reason is in case of 130 milligram per deciliter, small dense LDL is 20 milligram per deciliter. That means less the 110 milligram is the large dense LDL. In this case, you are healthy. But if the small dense LDL is higher than 35 milligram per deciliter, let me say they are 50 milligram per deciliter. In this case, the LDL cholesterol is large dense LDL. Then you will have a very high risk to cause atherosclerosis. That's why measurement of the small dense LDL cholesterol is essentially required. So this is a mechanism why the atherosclerosis caused. In case of the large dense LDL cholesterol flow directly through the blood vessel, whereas small dense LDL cholesterol is passed through the vessel wall due to the small size and easily turned into the oxidized LDL. Then where they are phagocytosed by the macrophages and become home cell, which cause atheroma. The atheroma built up plaque, narrowing blood vessel, causing atherosclerosis. This was mechanism we know. Alpha-cyclodextrin is a special dietary fiber that can reduce small dense LDL cholesterol. Here are the third findings. Absorption, inhibition, and carbohydrate and lipid by the alpha-cyclodextrin in small intestine. To understand the mechanism to reduce the small dense LDL by the alpha-cyclodextrin intake, I have to explain the suppression of the fat absorption by the alpha-cyclodextrin and also their blood sugar level. First, suppression of the fat absorption. here, human study, two human study, both we have to consider why. The why, first human study is why blood cholesterol level is reduced by intake of the alpha cyclodextrin. Here, cyclodextrin conference, everyone knows that the cholesterol is fit well with beta cyclodextrin cavity. So, but in this case, the cholesterol, that's why the cholesterol cannot be encapsulated by the alpha cyclodextrin because the cavity is small. So but actually here, this is human study. By taking 6 grams of the alpha cyclodextrin a day for a month, and cholesterol level could be reduced significantly here. Why is that? Then we elucidated mechanism. Then reported in 17th International Cyclodextrin Symposium held in Germany in year 2014. To explain the detail, again, it is a long time, so I want to use again the video, so skipping this data, and here, using a video, in small intestine, bile acid missile is available to promote cholesterol absorption in the small intestine. So this bile acid missile, resting in the bile acid missile play an important role for the absorption of the cholesterol. And when food containing cholesterol is coming in a small intestine, cholesterol is effectively incorporated into the bile acid missile with the presence of the lectin. Then cholesterol is solubilized and absorbed into the body well. But in the presence of the alpha cyclodextrin encapsulates lectin and precipitate in the bile acid missile and makes bile acid missile incomplete. Under the situation, if the food containing cholesterol is coming, cholesterol cannot be incorporated in the bile acid missile because incomplete. So that's why alpha cyclodextrin prevents absorption of the cholesterol into the body. This was the mechanism. So here, again, the chemistry, the alpha cyclodextrin and lectin has a good chemistry compatibility we found. So next, why 1 gram of the alpha cyclodextrin inhibit absorption of the as much as 9 grams of triglyceride? This was a question from the human study. Because 1 by 1 complex, in this case, molecular weight of alpha cyclodextrin higher than the triglyceride. So but the human study is available here, and after calculation, 1 gram of the actually alpha cyclodextrin intake reduced 9 grams of the triglyceride. The reason we found is because of the micelle formation and increasing the micelle missile. Again, I want to use just a video to brief explanation here. In small intestine, triglyceride is entering, and usually a lipase is available to hydrolyze the triglyceride and hydrolyze the fatty acid solubilize into the body. This is a normal absorption way. And but in case in the presence of the alpha cyclodextrin, the triglycerides can be encapsulated, but only one of the 3 fatty acids are in. That means lipophilic part and hydrophilic part both are in complex. That's why making a micelle. And then from the outside, the triglyceride is incorporated into the micelle. So then micelle becoming larger. Then if lipase is coming, lipase cannot react with the inside of the triglyceride. So next one is suppression of the blood sugar level by the alpha cyclodextrin. The human study, inhibition of the postprandial blood glucose elevation when consuming carbohydrate meal. The alpha-cyclochrine can do that, but not only alpha-cyclochrine, but the other dietary fiber also have the inhibition effect. This is because of amylase enzyme inhibition. So they are not only alpha-cyclochrine, but the other dietary fiber. But the alpha-cyclochrine inhibit not only carbohydrate but glucose. There are inhibition of the postprandial blood glucose elevation. They are when consuming glucose. The glucose is the smallest molecule, so they should be absorbed in any case, with or without carbohydrate, because no necessity to decompose, they are hydrolyzed. But the alpha-cyclochrine has good effect to reduce the blood glucose elevation. What is that? And here, we did not know, but the Chiba University's group elucidated the mechanism here. They are using our findings. Already I told the formation of the lecithin alpha-cyclochrine complex in the intestinal fluid, giving suppression of the cholesterol absorption. Then using these findings, they evaluated the gene activation, SREBP2, related to the cholesterol metabolism and cholesterol secretion from the pancreas. Then inhibit glucogenesis in the liver. This is a mechanism we found. So, because we know the suppression effect of the alpha-cyclochrine, then now I can explain about the reduction of the small dense LDL cholesterol. Human study is available here at the NIH, National Institute of Health in US. They are reported small dense LDL cholesterol can be reduced by the alpha-cyclochrine intake. So there are two causes for the formation of the small dense LDL. That is insulin resistance and also the large amount of the high triglyceride. So as you can see, that there are no other dietary fiber, but only alpha-cyclochrine is effective because of the inclusion phenomenon. One is the formation of the lecithin alpha-cyclochrine complex in this intestinal fluid, already explained, suppressing blood glucose elevation, improve the insulin resistance. Then the other one is formation of triglyceride alpha-cyclochrine complex followed by the mast cells, suppress triglyceride absorption, reduce blood triglyceride level. So that's why alpha-cyclochrine can reduce the small dense LDL cholesterol. So actually there is an effect of the decreasing atherosclerosis by the alpha-cyclochrine using ApoE knockout mice, which is used as atherosclerosis model. You can see low-fat diet group. In case of the high-fat diet, Western diet group has much higher atherosclerotic region. They are very high. But the high-fat diet, Western diet, if you take together with alpha-cyclochrine, then you can see the level is the almost same of the low-fat diet. But beta-cyclochrine and inulin, such a dietary fiber cannot be seen the same effect. So I talked about small dense LDL cholesterol, and in the beginning I talked about adiponectin. This is related. The adiponectin amount has a negative correlation with small dense LDL cholesterol. human studies available. Intake of the alpha-cyclodextrin reducing small dense LDL, already I told. But in this case, adiponectin could be increased. Actually, there is a report, diabete, using a diabete. Here, diabete participants were randomized to the alpha-cyclodextrin intake active group and the placebo group. Then each participant took the 20 milligram meal with or without 2 grams of alpha-cyclodextrin 3 times a day. That means 6 grams a day for a month. Then adiponectin level was, you can see, significantly increased in the alpha-cyclodextrin intake group. That means intake of the alpha-cyclodextrin reducing small dense LDL and increasing adiponectin level. That means prevention of not only the atherosclerosis but also the diabetes. So the last one, I want to talk about enlargement of the adipocyte is the cause of the lifestyle-related disease, obesity. I want to talk about obesity. Yeah, alpha-cyclodextrin can prevent obesity. Always question. Alpha-cyclodextrin is the special dietary fiber for the butyric acid production. We know butyric acid produced by the gut microbiota suppresses enlargement of the adipocyte and keep healthy small adipocyte, secrete adiponectin and for prevention of obesity. At the moment, a bit difficult for you, but I want to explain what is adipocyte. Adipocyte, the healthy small adipocyte secreting the adiponectin. And the enlarged adipocyte causes obesity. I want to explain with the video here. Healthy small adipocyte store usually energy by uptaking the fat. And the adipocyte secrete beneficial cytokines such as adiponectin and leptin usually. So the adiponectin enhances insulin action and glucose uptake in the muscle and liver. So the adiponectin play an important role in lowering blood sugar level. So the usually adipocyte with normal size uptake fat, as I told, and differentiate and increase the number, only increase the number. But the if adipocyte uptake too much of the fat, then lose the ability of the differentiate become enlarged. Here. So this enlarged adipocyte is the real problem. In case, as I told, healthy adipocytes secrete beneficial cytokine. On the other hand, enlarged adipocyte not only reduce adiponectin but also secrete harmful cytokines such as TNF-alpha. So the harmful cytokine increase inflammation throughout the body, blood pressure, and risk of atherosclerosis. This is mechanism. So the last one, intestinal environment, in large intestine, improvement of the intestinal environment by the alpha-cyclodextrin. First of all, I have to tell you about dietary fiber. The fundamental difference of the alpha-cyclodextrin and other dietary fiber. Alpha-cyclodextrin is really a dietary fiber. But alpha-cyclodextrin is a single molecule. Everyone knows here that there are only glucose, 6-glucose makes the alpha-cyclodextrin. But the other water-soluble dietary fiber are always a mixture. Different molecular weight and the monosaccharide, glucose, fructose, and glucose. So this is the digestion and fermentation degradation of the cyclodextrin. 3 cyclodextrin are totally different. As you can see, alpha-cyclodextrin here, this molecule, alpha-cyclodextrin, is not digested by the alpha amylase. That means single molecule. That's why no digestion at all. That means alpha-cyclodextrin can act as a 100% dietary fiber. So that means alpha-cyclodextrin is going to the large intestine 100%. There, alpha-cyclodextrin is fermented by the intestinal bacteria. That means 100% of the alpha-cyclodextrin acts as a prebiotics. And prebiotics, very important, recently known, is a short-chain fatty acid. Alpha-cyclodextrin is converted into the short-chain fatty acid, which has is a key substance for the various health benefit. Now we know. So this is data from the Waka Chemi CO2 emission after taking alpha-cyclodextrin and gamma-cyclodextrin. In case of the gamma-cyclodextrin, after taking, there are 2 hours later, already Tmax is coming. That means the gamma-cyclodextrin is digested by the amylase. But in case of the alpha-cyclodextrin, Tmax is coming very slow, 10 hours. Then that means not amylase, but by the bacteria, it is fermented. So actually, germ-free rat without bacteria, no CO2 emission. So then very interesting the area of the undercurve, AUC. AUC of the with gamma-cyclodextrin and AUC of the alpha-cyclodextrin almost same. That means AUC proved that alpha-cyclodextrin is 100% converted into CO2 via short-chain fatty acid. This is very important. That's why we made a vitro study comparison with the various prebiotics. Alpha-cyclodextrin galacto-oligosaccharide, fructo-oligosaccharide, indigestive dextrin, isomaltodextrin, inulin, polydextrose, partially hydrolyzed guar gum, and lactose growth. Then we see bacteria growth, in this case the bacterium butyrate producing bacteria, and butyric acid and hydrogen gas. Always alpha-cyclodextrin is the best compared to the other prebiotics. So here we can say intake of the alpha-cyclodextrin, increasing bacteroides and butyric acid production. So today's main topic is the anti-obesity effect, but little bit I want to tell you about the activation of the Treg cell, because recently Professor Sakaguchi received the Nobel Prize with Treg cell. That's why I want to tell a little bit the activation of the Treg cell, improvement of the autoimmune disease. So the butyric acid converted from the alpha-cyclodextrin induced differentiation of T cell to regulatory T cell and improved colitis and allergy. Furusawa reported the comparison of the 4 dietary fiber: alpha-cyclodextrin, inulin, polydextrose, sodium aligninate. The alpha-cyclodextrin is the most promising prebiotics to increase the bacteroides, promote butyrate production here, and improve the anti-inflammation response through the Treg cell induction here, improving colitis. And our study, human study, is improvement of the allergy by alpha-cyclodextrin intake through the Treg cell induction. Atopic dermatitis patient, 15 subjects. And you can see reduction of the itching as one of the atopic symptoms, and also IgE reduction here. So this is just an example. The atopic skin is improved. So now here, today's main topic, to keep healthy small adipocyte anti-obesity. So the first, our study is vivo study. Reported in year 2018. The method is mice were had 3 group: normal diet and high-fat diet. High-fat diet with alpha-cyclin for 16 months. So that we see bacteroides increase and short-chain fatty acids increase. Bacteroides increased, so that's why anti-obesity effect we observed. As you can see, this is normal diet and high-fat diet. And the high-fat diet with alpha-cyclin suppressed the body weight gain here. And not only that, adipocyte, we see I explained about large enlargement of the adipocyte. In case of normal diet, it's small, and high-fat diet is bigger. So they suppress the enlargement of adipocyte. Then body weight and fat accumulation is reduced here. So their mechanism is the key is a pipa gamma. Intake of the alpha-cyclodextrin upregulated the pipa gamma in the adipose tissue. Pipa gamma is known to promote adipocyte differentiation, apoptosis of the enlargement of the adipocyte, and increasing insulin-sensitive small adipocyte. You can see. So it is thought that butyric acid produced by the intake of the alpha-cyclodextrin resulting in upregulating pipa gamma here. So this was the data that actually anti-obesity effect is observed, but not perfect, satisfactory enough. So we finally found the radish alpha-cyclodextrin powder, MTBI alpha-cyclodextrin, has excellent anti-obesity effect. This is second vivo study. Almost same with the first study, but difference is the mouse head. The first study is 3 groups. Normal diet, high-fat diet, and high-fat diet with alpha-cyclodextrin, the first. In addition, we did the high-fat diet with MTBI alpha-cyclodextrin, radish alpha-cyclodextrin complex, for 16 weeks. So what is MTBI here? I want to explain. The 4-methyl-thiol, 3-butenyl isothiocyanate, MTBI, is a present bioactive constituent found in radish, showed excellent anti-obesity effect among various isocyanates. But the problem of MTBI is very easily decomposed, hydrolyzed to the pyrrolidone here. That's why stabilization is required. Whether alpha-cyclodextrin can be used? So we checked the stability, MTBI with alpha-cyclodextrin. Grated radish was mixed with cyclodextrin to achieve a concentration of 10 weight %. In case of the molecular ratio of the MTBI to the cyclodextrin is 1 to 60. And MTBI stabilization was evaluated when stored at room temperature. As a result, with a sample without presence of the cyclodextrin, as you can see, decreased over time, and after 60 minutes, remaining MTBI was less than 10%. But the sample adding cyclodextrin show improved stability in any case, and particularly here, in case of the adding alpha-cyclodextrin, 80% of the MTBI remained after 2 hours. That's why selected alpha-cyclodextrin and we evaluated amount, and it was confirmed the adding more than 50 times of the alpha-cyclodextrin to the MTBI here significantly improved the stability after 15 minutes to 30 minutes. So accordingly, the ratio of the alpha-cyclodextrin to the MTBI in the radish alpha-cyclodextrin powder used in the vivo study is at 60 to 1. So we see whole group, the completely same data obtained with the first study regarding 3 groups. Their normal diet, high-fat diet, body weight gain. Then alpha-cyclodextrin is effective to suppress but here is the MTBI alpha-cyclodextrin. Actually, far higher anti-obesity effect observed compared to the alpha-cyclodextrin. Here, the adipocyte, we checked normal diet and high-fat diet enlarged, and the enlargement is suppressed, but the MTBI is perfect. So I can say MTBI alpha-cyclodextrin intake has an effect to keep the healthy small adipocyte, secrete adiponectin. So here is a summary. Life-related disease can be prevented by the gastrointestinal cyclodextrin chemistry. If you take the statin, please take the coenzyme Q10 gamma-cyclodextrin complex, increasing adiponectin secretion. The alpha-cyclodextrin then reducing the diabetes risk. And in case of the alpha-cyclodextrin, reduce small dense LDL cholesterol, which is a reduction of the small arteriosclerosis risk. And the radish alpha-cyclodextrin powder, that is MTBI alpha-cyclodextrin, prevent enlargement of the adipocyte, prevent obesity. But if you see it, as I told, reduction of the small dense LDL is increasing adiponectin secretion, and the prevention of the enlargement of the adipocyte is also the increase of the adiponectin secretion. So you can remember this slide. Adiponectin is an essential compound for the health longevity. So please take alpha-cyclodextrin. Thank you for your attention.